Hi, everyone. This is Team Jetlag Airlines. Today, we're presenting our large database research project on non-smoking lung cancer mortality within Asian American subgroups. Our mentors are Dr. Wakely, Dr. Huang, and our implementation fellow, Tina Chang. My name is Jonathan Fan, and I'm from UCLA.
My name is Haley Sean, and I'm a fourth-year undergraduate student at UC Berkeley.
My name is Kwai Chung, and I'm a rising senior in New York University, Abu Dhabi.
According to World Cancer Research Fund organization, lung cancer is the second most prevalent type of cancer. The American Cancer Society reports that cancer rates have been falling steeply due to drastic declines in smoking. The sharp decline in smoking habits among Americans can be primarily attributed to anti-smoking campaigns. However, the rather large emphasis on smoking lung cancer overshadows important discussions of non-smoking lung cancers. The research on NSLCs or non-smoking lung cancers has started since 1994, with some of the findings suggesting that Asian Americans may potentially be at higher risks compared to non-Hispanic whites. There are still gaps within our current knowledge on NSLC. For example, what are the proportions of non-smoking and smoking lung cancer among Asian American subgroups? Does NSLC increase in mortality rates among Asian American communities? And how does nativity and culture impact such factor? With the new disaggregated data from National Center for Health Statistics, or commonly known as NCHS, we can finally start bridging the literature gaps for Asian American subgroups. Our primary research questions are: 1, which Asian American subgroup is most vulnerable to non-smoking lung cancer mortality? And 2, within the disaggregated Asian American population, how different are the proportions of non-smoking lung cancer and smoking lung cancer mortality rates? To calculate our age-adjusted mortality rates, we use smoking death counts as our numerator from the NCHS. We extracted data from 2014 to 2020 on the 6 largest Asian American subgroups. We then categorized lung cancer using the ICD-10 codes, which are the disease classification codes established by the World Health Organization. For our population denominator data, we looked to the American Community Survey, or ACS, to obtain population estimates broken down by sex, age, and nativity status. Using our population data and mortality data, we were able to calculate the age-adjusted mortality rate, or AMRs, per 100,000 individuals, and obtain lung cancer proportions with sex and nativity status breakdowns using RStudio. We then performed linear regressions for a trend analysis on the AMRs, and the results were further visualized through R coding in Excel.
Now let's take a look at these visualizations. Starting with the graph on the left, characterizing smoking lung cancer deaths by sex and smoking status. We can see that in the red, representing all males, is much higher than the blue line representing all females, indicating that males have higher rates of smoking lung cancer deaths. Both male and female overall populations experience decreasing trends in smoking-related lung cancer AMRs. Shifting our attention to the right, we see that non-smoking lung cancer is much higher in female populations compared to their male counterparts. Another important thing to note is that non-smoking lung cancer mortality is increasing every year in both sexes. With these concerning results, we want to take a closer look at what proportions of non-smoking and smoking-related lung cancer deaths contribute to total lung cancer mortality broken down by Asian American subgroups. The figure on this slide demonstrates the proportion of lung cancer deaths by smoking status across both status. Non-smoking lung cancer is reported in red, while blue represents smoking-related lung cancer. We can see here that Asians in particular, Chinese, Indian, and Vietnamese Americans have a significantly higher proportion of non-smoking lung cancer deaths in comparison to non-Hispanic whites. Moreover, when analyzing these proportions for the respective female population, we can see that these trends are the same primarily, but amplified. This figure shows that the proportion of lung cancer deaths by smoking status among the female populations, all female Asian American subgroups have at least 50% of lung cancer mortality attributed to non-smoking lung cancer. Incredibly, over 85% of all lung cancer deaths among Chinese, Indian, and Vietnamese females were non-smoking lung cancers.
Now, we look into nativity and non-smoking lung cancer. We can see that non-smoking lung cancer AMR for both the US-born, which is illustrated in red, and non-US born Asian American population, which is illustrated in blue. Here, we can see that the US-born population, AMR, are more than twofold smaller than the Asian American non-US born populations. However, both the US-born and the immigrant Asian American population are experiencing an increase in non-smoking lung cancer, with the immigrant population having a steeper rise. When we observing this trend with disaggregated Asian American data, our immigrant non-smoking lung cancer show an increasing rate for all years regardless of subgroup. On the other hand, when we look at the US-born population only, we see a more variability in terms of the trend change with noticeable decrease in the Vietnamese Americans and the Chinese populations. Hence, they might become a case study for health behavioral, so that it gives us clue to mitigate the impact of non-smoking lung cancer on Asian American health. So what are key insights? If we are looking from the lens of sex and non-smoking lung cancer, first, the non-smoking lung cancer are becoming a greater concern and it's affecting the Asian American group disproportionately with 50% of all mortality from lung cancer or non-smoking. Second, non-smoking lung cancer AMR are primarily increasing across the board for all of the study populations. And finally, Asian American female group have much higher proportion of non-smoking lung cancer, and it's especially true with Chinese, Vietnamese, and Indian at over 85% for female. If we look at the lens from nativity, non-smoking lung cancer AMR in non-US born Asian American is estimated 1.7 times higher than the US born population in 2020. And while the increasing and decreasing trend in non-smoking lung cancer in US born population, the non-US born Asian American population experienced an upward trend only. So this unique lung cancer death pattern suggests that Asian American female may have different genetic or environmental risk factors for lung cancer compared to non-Hispanic white. And moreover, as non-US born population has higher non-smoking lung cancer mortality, which suggests that culture may influence the mortality of non-smoking lung cancer. Our research still faces some limitations. Our trend analysis only covers a total of 7 years worth of data, which is a relatively short amount of time. Another limitation is that a no-smoking status accounts for a large proportion of smoking status data. So the proportion of no-smoking status appear on the chart below in blue, and it can disrupt our presentation finding. And finally, here's our list of reference for these presentations. And we want to say thank you for our mentor for their patience and dedication in our success, and we're looking forward to working with them in the futures. Does this conclude our presentation, and thank you for listening. Does anyone have any questions?